The recovery from a breast lift is quite rapid. Most patients have it as an outpatient. They're back at home that afternoon or evening. They're up and around having hopefully a nice dinner and having very little discomfort. They're usually in a sports bra, and they usually shampoo and shower the day after surgery. There's typically no drain tube. So it's surprisingly one of those procedures that many people think is a significant recovery, and in reality it's not. You're just removing skin, and for the most part it's very simple. You can usually get back to the office environment in 2 to 3 days. You can usually drive in 2 to 3 days whenever you're off the narcotics or pain medicine, if you're taking any. Many people just take Tylenol. And then for the most part, activities and exercise are 2 to 3 weeks, like most procedures, because you don't want to raise your heart rate and blood pressure and put a lot of blood flow through the healing tissues. You kind of see your final result after 3 to 4 weeks, maybe 6 weeks at the most, because everything kind of shrinks, and then you can kind of assess, what your final result will be. As far as the complications are infrequent. However, the two biggest ones are technically related to moving the nipple and the areola upwards. When you move the nipple and the areola upwards, you have to make sure you maintain the blood supply to the nipple and the areola when you shift it up. And so the nerve supply and the blood supply are critical to maintain and are very rare complications, especially with regard to the blood supply. As far as the most common complication, which is more of a side effect, sometimes where all the incisions meet in this area is a tight point to create the shape of the breast. And sometimes you'll have a little crust or a little scab develop there that will heal on its own after several days, and sometimes a little antibiotic ointment is necessary. Knowing these little things ahead of time make it less anxiety prone if that develops, and that's not uncommon in probably 20% of patients. Otherwise, it's a relatively straightforward procedure with excellent results. Probably the most common problem 1 or 2 years later is that the skin has relaxed a bit, and so what was originally a much higher lifted breast is a little bit lower, because the skin elasticity is the entire reason someone needs a breast lift. So in many patients, we tell them they may need the skin tightened again within a few years, because you haven't stopped the genetic predisposition for the skin to relax, which is the reason they needed a breast lift in the first place. Again, knowing that ahead of time helps patients understand the process, but for the most part, very successful procedure and a very easy recovery.